Thank you so much for being with us today. So to
Welcome.
start, what is your name and title, and what procedures and research do you work on?
So I'm Ihab Alomari. I'm one of the interventional cardiologists. So I am a cardiovascular specialist and subspecialized interventional and structural portion of it. Meaning, I get to deal with, the heart attacks, the valves of the heart, fixing tight valves or leaky valves. And I am an associate professor at the School of Medicine.
Great. And what disease conditions do you treat? And specifically with regards to the Watchman, what does that treat?
So, there's a wide variety of procedures or diseases we treat, but mainly as an interventional cardiologist, again, it's like being the plumber of the heart. So fix blocked arteries, dealing with heart attacks, and fixing valves through minimal invasive procedure rather than open heart surgery. So if you have a valve that's tight, we put a new valve in it through the groin. If you have a valve that's leaky, we can actually clip it and fix it also through the groin. In addition to what we're going to talk about is the Watchman procedure, or what we call the left atrial appendage occlusion.
And for the Watchman procedure and the left atrial appendage occlusion that it provides, what's important to know about the disease condition?
So this is for the left atrial appendage occlusion, or what we refer to as Watchman procedure, because that's the device name, is a procedure that we use in patients with atrial fibrillation. And the purpose of the procedure is to help patients get off blood thinners safely and at the same time protecting them from having a heart attack. The reason is with patients with atrial fibrillation, the upper chamber is not contracting like this. It will be kind of like fibrillating like this. And then there is an appendage, which I'm going to show you here. So this is model of the heart. And if you see that this is the chambers of the heart, obviously, the right atrium, left atrium, right ventricle, left ventricle. And in the left atrium, there is this pouch, which is called the left atrial appendage. When the heart is not moving well, when it's actually that the atrium is in atrial fibrillation and is doing like this becomes a really good environment for clots to happen. And if clot happens there and it gets dislodged, then it will go to the brain, and that will give patients stroke. So about 90 to 95% of the stroke happening in patients with atrial fibrillation is actually coming from here, from this problem. So the left atrial appendage occlusion, or the Watchman procedure, is basically a procedure that we go, through the groin with a catheter that will hold the device, which is basically, this is the, a model of the Watchman device. So it's basically kind of like few struts and covered with fabric. It will be compressed, and it goes like through the groin, through the inferior vena cava, all the way to the heart. To the right side, we do a transseptal puncture, and then we cross to the left atrium. And then we place this device in the ostium of the left atrial appendage. And with that, it's basically, we're putting like a pacifier on the left atrial appendage. And with that, this will separate the left atrial appendage from the rest of the heart. So whatever clot happened there, it's not going to be dislodged from the heart. In few weeks, this will be covered by normal heart tissue most of the time. And, it will be kind of like part of the heart. And patients with this can get safely off the blood thinner. The traditional treatment for patients with atrial fibrillation before this is only blood thinner. and you give the patient strong blood thinner, like anticoagulants, what we know as Coumadin, Xarelto, Eliquis, all these strong blood thinner to prevent clots from happening here. But the problem is a lot of patients, they cannot take blood thinner, either because they have a history of bleeding, so it's contraindicated for them, or they have active, kind of like, ulcers and other stuff. They could have, imbalance and falls, or they cannot just, they can't tolerate the blood thinner for any other cause. Even high risk occupation, like someone who is a pilot, someone who is in sport, those people, for example, or a fireman, they should not be on blood thinners because, these are high risk occupation and they take care of a lot of people. And if they bleed, it's a major issue during, while they're working. So this device is indicated for the above, indications, I will say. And that's now the current most useful, I will say, procedures for these patients to get them off the blood thinner safely.
That makes a lot of sense. So were there any, is it correct to say there were no other procedural interventions prior to the Watchman? Only the warfarin, Coumadin, blood thinner, pharmacological approaches?
I will say, mainly the warfarin, the blood thinners. There is a surgical clipping of the left atrial appendage. So if someone is actually going for surgery and he has atrial fibrillation, like for open heart surgery, they're going to fix the valves or they're going to fix the arteries, do bypass. At the same time, if the patient has atrial fibrillation, the surgeon most of the time will just clip, the left atrial appendage. And he will do that, but while the chest is open. Now, obviously, you don't do this just because you want to open. You don't open the heart of, the chest of the patient just to do this procedure. This is something that if you're opening it to do something else, since you're there, you just like clip it. So more of a kind of like a surgical stuff. But I will say that there are, a few devices now that's coming out similar to the Watchman. The idea will be the same, which is separating the left atrial appendage from the heart. But the most commonly used device worldwide and in the US is the Watchman device.
So do you see any room for improvement on the current Watchman device in terms of something you noticed about its structure? Or like you mentioned, it's biocompatible. Is there room for improvement in some of those dimensions? Or do you see it as a new product later on?
Yes. So actually they just released this last year, which is the Watchman Flex, which is a much better device than the previous generation. This is obviously, can go into even smaller appendages and with more difficult anatomy because of the structure and the engineering of the Watchman, of the device itself. I think that the major improvement will be, reducing the sheath size that we use, because one of the main problems that could happen to the patients, after the procedure is bleeding because the sheath size is big. And I think the smaller the sheath, that's gonna, make this procedure much safer. And I'm still pretty sure that there is like more improvement that can be done on this device, even to accommodate more and more challenging anatomies of the left atrial appendage. And we're hoping to see this in the next generation.
Makes sense. And thank you so much for your time. I think that answers the questions we have.
You're welcome. You're welcome. Thank you.